What if your dream of starting a family was looking more and more doubtful? That's what some couples face when trying to have a baby, though most never imagined it could happen to them. In Highland Park, a suburb of Chicago, Kelly and Tom Cherwin make their home. They discuss starting a family shortly after they got married.
Since we got back from our honeymoon, we kind of just said, let's just let what happens, happens. And that's what we've done. And that was 8 years ago.
Kelly is currently an art history professor at Oakton Community College in Illinois. By age 32, she had achieved most of her goals, a successful marriage and career. What was missing were children. It was then she realized something was wrong.
It just all of a sudden one day dawned on me, wait a minute, we haven't been doing anything to stop this, but nothing's happening. So it was about then that I went to the doctor.
In many cases, an obstetrician-gynecologist can work with couples who are having difficulty becoming pregnant to help them resolve their problems.
Fortunately, most are able to conduct the initial battery of tests and in fact initiate early treatment. If they find certain problems or if the initial test proved to be too complicated, they are then looking to refer them to a reproductive endocrinologist who has had advanced training besides obstetrics and gynecology to treat the problems. If a woman has difficulties with normal ovulation, or sometimes simply in order to increase the odds of getting pregnant, the reproductive endocrinologist will use fertility drugs to stimulate the ovaries.
Kelly and Tom tried several fertility procedures with no success. And after 2 extremely disappointing in vitro fertilization cycles, or IVF, they decided to try one last time, in combination with the latest technique, pre-implantation genetic diagnosis, or PGD. Kelly remembers the phone call she received from the doctor's office while out shopping.
I sat down on a display, which I don't think you're supposed to sit on, and I just started crying, and everybody was looking at me. Are you okay? I said, yeah, I'm okay. I'm not going to tell everybody in the genes department what's going on.
PGD is what helped Kelly and Tom get pregnant. It is a method used to discover possible genetic abnormalities in embryos before these embryos are implanted into their mother.
In its infancy is the use of pre-implantation genetic diagnosis, where the ability of an embryologist to select an embryo simply on the basis of microscopic appearance and the developmental quality has now been even further added to by the ability to eliminate embryos that have severe chromosomal abnormalities that would result in no pregnancy or a damaged embryo that would miscarry.
It's been a long, emotional road for Kelly and Tom. And as they prepare for their new arrival, they are extremely grateful that they got the chance to fulfill their dream.
When you start going through this process, you do realize, wow, it is pretty amazing. I said to my husband probably every week, I can't believe anybody in the world ever gets pregnant, period. Because there is just so much that has to happen. It's not as easy as you think.
2 embryos were healthy enough for Kelly and Tom, and one did the trick.
We picked the name Liam because Liam means warrior. And we thought out of all of those eggs, he's the one that said, you know, this is my territory, I guess.
Infertility can be a frustrating and even mysterious experience for couples. Kelly and Tom Cherwin say that although it wasn't easy, having as much information as possible helped them through this difficult time. But with the advances in reproductive medicine today, couples may eventually experience the precious gift of a new life.